We have about 40 million uninsured patients. It's a very, very huge problem in the US because the hospitals don't really get compensated for treating those patients. My name is Jonas Heese. I'm an assistant professor at the Accounting and Management Unit. So what they actually did is, in a very, very simplified way, they would claim instead of you didn't have a broken arm, but you had a broken arm with complications. And by adding like a complicating factor, they were able to generate more money from the insurance company. This is almost like a Robin Hood story. So you would take money from the insured one and using this money to treat the uninsured ones. These fraudulent billing is like a very, very significant number. I think it was close to 50 billion last year, which is about like 10% of total Medicare payments per year, which is a very, very huge amount. So the question is, if we know for over 30 years that those fraudulent payments occur, why don't we try to do something about it? Why don't we try to prevent it? And indeed, what I can show and what I can find is that the regulator is less likely to prosecute those hospitals for engaging in overbilling. Could it actually be that the regulator is willing to look the other way for certain types of hospitals? To a certain degree, we accept that regulatory agencies are out there. We know they have a big effect and impact on our lives, but we don't really understand, do those regulatory agencies also make certain choices? So on the one hand, the objective is reduce costs, which is related to reducing fraudulent billings, but at the same time, ensure and increase healthcare coverage. I think this study gives a good example that the regulator is aware that going tough on this aggressive or potentially fraudulent billing could have very, very negative consequences for certain hospitals. They might not be able to treat those uninsured patients anymore. In the worst case, they might actually run out of funding and might have to close down. The question actually is that an outcome that we would want to see?